Assalamu alaikum. My name is Talal Khottab and I'm going to talk about hypertension. So, what's hypertension? Hypertension is a chronic medical condition in which the blood pressure in the arteries is elevated. Blood pressure. Blood pressure is summarized by two measurements, systolic and diastolic, which depend on the heart muscle. So when heart muscle is contracting, this is called systole, or relaxed between beats, this is called diastole. This equals the maximum and minimum pressure. In this picture you can see the difference between diastole and systole. Now I'm going to show you this video about blood pressure.
High blood pressure, or hypertension, is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients. In your heart, two chambers, called ventricles, contract with each heartbeat to push blood to your lungs and through your arteries to your body. As blood flows through them, three main factors affect the pressure on your artery walls. The first is cardiac output, or the amount of blood your ventricles push out of your heart each minute. Your blood pressure goes up as cardiac output increases. The second factor affecting your blood pressure is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects your blood pressure is resistance, which is anything working against the blood flow through your arteries. Several factors contribute to resistance. One resistance factor is the flexibility of your artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of your arteries. Your body is able to increase the diameter of your arteries to lower your blood pressure, or reduce the diameter to raise your blood pressure. A third resistance factor is blood viscosity, or thickness. In your blood, more particles, such as proteins and fat, increase viscosity. If your blood is thicker, your blood pressure goes up as your heart works harder to push it through your arteries.
In this table, I'm going to show you different types of hypertension. Here is the question. Why is hypertension dangerous? In next video, I'm going to show you why hypertension is dangerous.
First, the heart works harder to pump out more blood, or against higher resistance. The heart then requires more oxygen and is more susceptible to angina or a heart attack. Second, arteries and arterioles can be damaged. Arteriosclerosis results when blood moves through arteries and arterioles at high pressure, damaging the vessel. White blood cells are drawn to the damaged area to form plaque. Third, kidneys can be damaged. The capillaries of the kidney are delicate. Continually subjected to high blood pressure, they break down, becoming permeable to proteins and other molecules. The kidney's tubules can become clogged, decreasing the kidney's ability to make urine. Also, the proteins injure the capillaries' membranes, causing more damage and worsening the situation. Fourth, the retina of the eye can be damaged if its delicate capillaries are damaged. Localized hemorrhages can occur, causing scarring and formation of new imperfect capillaries to replace the old ones. Finally, the blood vessels of the brain can be injured. High blood pressure can cause clots to break off from atherosclerotic plaques, blocking blood flow to the rest of the brain. This is called a thrombotic stroke. Continual exposure to high blood pressure may also cause a blood vessel to burst, leading to a hemorrhagic stroke.
Causes of hypertension. There are two types of hypertension. First one called primary hypertension and the secondary hypertension. Primary hypertension causes are unknown but linked and related to risk factor. And it's the most common hypertension. It's between 90 to 95 of hypertension cases. Secondary hypertension. 5 to 10% of hypertension cases caused by disease state like kidney disease, hormone imbalance, atherosclerosis, or by using some types of medication. Risk factors. Risk factors divided to two types, controllable and uncontrollable. Controllable, so a patient can stop these factors. Uncontrollable, patient cannot stop them. Now let's look to pharmacological treatment. There are many classes of drug they use to treat hypertension. As example, diuretics as hydrochlorothiazide, furosemide, beta blockers as atenolol, propranolol, AC inhibitors as captopril, lisinopril, calcium channel blockers as amlodipine. Here's some picture for these drugs. Amlodipine as a calcium channel blocker, atenolol as a selective beta-1 blocker, lisinopril as ACE inhibitors. Furosemide as loop diuretics and hydrochlorothiazide as thiazide diuretics.